بسم الله الرحمن الرحيم. محاضرة اليوم أحد المواضيع اللي تتعلق بالسوفت تيشو of the head و the scalp. The scalp is the upper part of the head. كلمة scalp مكونة من حروف 5 هي SCALP وهي التي تكون طبقات the scalp. The scalp extends from the supraorbital margins anteriorly to the highest nuclei line at the back of the skull and down to ear and zygomatic arch at the side. So this is the upper part of the head is the scalp. The extent of the scalp anteriorly from upper margin of the orbit, posteriorly to the posterior external posterior external occipital procerus and superior nuchal line, laterally to the superior temporal line and the upper part of the zygomatic arch. The forehead is part of the face and part of the scalp. So the forehead from eyebrow to hairline, or what it should be, is common to the face and the scalp. The scalp consists of 5 layers, the first 3 of which are intimately bound together and move as one unit. The first letter of each layer is formed word of scalp. The first layer is the skin, S. Second layer is subcutaneous tissue or connective tissue, so C. The third layer is muscular aponeurotic, A. Aponeurosis. Fourth layer, the retaining ligament and spaces that have the L, loose auricular tissue. The last layer, the fifth layer, is the periosteum and the fascia, the P. So this 5 layers that form. The first layer, the outer layer, is the skin, is as the letter S, which is the thickest and part of the skin in the body, and the thickest of all the occipital region. As the thick part of the skin in the body here is scalp, where the thickest part of the scalp here, posterior part, is the occipital region. It have hair bearing and contain numerous sebaceous glands. That it is the part of the scalp is completely that have as a hair. The second layer beneath the skin is connective tissue as C. The connective tissue beneath the skin, which is fibrofatty, the fibrous septa uniting the skin to the underlying aponeurosis of occipitofrontalis muscle. Numerous arteries and veins are found in this layer. The arteries are a bunch of external and internal carotid arteries, and free anastomosis takes place between them. So we have anastomosis of the external and internal carotid artery that have, if any, damage to any artery that can give its nourishment by the other artery. بهذا السكالب مهم لأنه يغطي السكال and inside the skull the brain. بهذا the blood supply is very important and very rich. So any simple injury lead to profuse bleeding, but easily stop the bleeding by pressure on the skin and that press on the hard bone, so stop. The third layer is aponeurosis or epicranial as a letter, which is a thin tendinous sheet that unites the occipital and frontal belly of occipitofrontalis muscle. العضلة الوحيدة اللي موجودة في السكالب هي occipitofrontalis muscle. It is 2 parts. The inside of these 2 parts, the tendon, is aponeurosis. The lateral margin of the aponeurosis are attached to temporal fascia within the zygomatic arch. The space beneath the aponeurosis, called a subaponeurotic space, is potential space, not a real space, beneath the epicranial aponeurosis. It is limited in front and beyond by origin of occipitofrontalis muscle and extend laterally as far as the attachment of aponeurosis temporal fascia. The fourth layer is loose auricular tissue as a letter, which occupies the subaponeurotic space and loose connect the epicranial aponeurosis to the periosteum of the scalp. The pericranium. The auricular tissue contains a few small arteries, but it also contains some important emissary veins. The emissary veins are valveless and connect the superficial vein of the scalp with the diploic vein of the scalp bone and with the intracranial venous tissue. Sinus. الاتصال ما بين الانتراكرينيال venous sinus و extracranial superficial vein of the scalp by a diploic vein. هذه الدايبلوك vein هو منطقة خط انتقال microorganism from outside to inside. So it is very important to be in health condition of the scalp. The last layer is pericranium, or call it periosteum, as a P letter. The pericranium, which is the periosteum covering the outer surface of the scalp bones. At the suture between individual scalp bones, the periosteum on the outer surface of bone become continuous with the endosteum on the inner surface of the scalp bone. So the periosteum is the last layer that attach the upper surface of the bone and its continuity within the suture to the endosteum that lining the scalp from inside. So this is a layer as skin, connective tissue, aponeurosis, loose auricular tissue, and pericranium. And beneath the pericranium, the skull bones, and then inside the endosteum. And beneath the endosteum, the meninges that cover the brain. The layer of the scalp, as you see in this diagram, is the first layer is skin, thick, many sebaceous glands and muscles inserted in it. The skin, the muscle of facial expression that have within the orbit that have insertion within the skin of forehead, and posteriorly the muscle of neck can insert or origin from the layer of the scalp. The second layer is connective tissue. This layer is very vascular. You have a rich of blood supply that within this have artery, vein, arteriole, venule, and capillaries in this layer. The third layer is the aponeurosis that convert as epicranial aponeurosis and have a muscle that is origin or insertion that occipitofrontalis muscle. Occipitalis muscle onto superior nuchal line and posterior auricular branch of facial vein. The frontalis into skin of eyebrow and orbicularis oculi, the temporalis and zygomatic branches of facial nerve. The fourth layer is loose auricular tissue, and it is have a connective tissue in type is loose auricular. The last one, the pericranium, is a periosteum, loosely attached to bone, and it is possible under it's by limited to each bone. Now we discuss with you the muscle of the scalps. We have one muscle and two parts. It's called occipitofrontalis muscles. This occipitofrontalis consists of occipitalis and frontalis muscular part with an intervening epicranial aponeurosis as a gilla aponeurotica between these two muscles, into which they are inserted at back and front or respectively. That is origin or insertion that occipitalis and frontalis muscular part. The frontalis part arise from the front of aponeurosis and pass forward to become attached to the upper part of orbicularis oculi muscle and the overlying skin of the eyebrow. The right and left frontalis muscle meet in midline. We have no any fibrous septa separate the right and left side of frontalis muscles. This figure shows as a diagram of the frontalis muscle and its origin and its insertion. The second part of occipitofrontalis muscle is from posterior side is occipitalis muscle. It arises from highest nuchal line and pass forward into the aponeurosis which lie over the top of the scalp. The muscle bellies are separated across the midline by aponeurosis which extend backward to attach to external occipital protuberance and the most medial part of the highest nuchal line. Laterally, the aponeurosis blend with the temporal fascia, superficial temporal fascia, and come down over the deep temporal fascia to the zygomatic arch. Rather, the two sides of the occipitalis muscle, right and left, is separated by fibrous septa, its extension from external occipital protuberance, and go anteriorly with the aponeurosis. This figure shows the two sides of muscle, and there are big septa that separate the left and right side of occipitalis muscle. The midline fiber blend with a procerus muscle. It is a small muscle that arises from the nasal bone and cartilage and inserts into the skin of lower forehead. Its contraction produces transverse wrinkles over the bridge of the nose. It is a small muscle that have its location between the two parts of frontalis muscle. This figure shows the small muscle in the mid of the forehead from the nasal bridge upward to the forehead. The nerve supply of this muscle is supplied by facial nerve, seventh cranial nerve, by the posterior auricular branch to occipitalis and temporal branch to frontalis. We have two branches of facial nerve. The first one is temporal branch that go to nerve supply to the frontalis muscle, and the posterior auricular branch of facial nerve that supply the occipitalis muscle. The action of this occipitofrontalis muscle is when this muscle contracts, the three layer of the scalp move forward as or backward. The loose auricular tissue of the fourth layer of scalp allowing aponeurosis to move on the pericranium, with presence of subaponeurocal space beneath the pericranium or aponeurosis. While occipitalis can pull the scalp back in certain individuals, usually it is merely encourage the aponeurosis, but frontalis elevate the eyebrow and produce wrinkle the skin of the forehead. حقيقة الأوكسيبيتالس muscle تأثيرها كلش قليل على حركة of the scalp. فقط أشخاص معينين عندما استطاع تحريك scalp by occipitalis muscle backward. بس الفرونتاليس muscle تترك wrinkle in the forehead and move the eyebrow upward. The sensory innervation of the scalp. The main trunk of the sensory nerve lie in superficial fascia, moving lateral from midline anteriorly. Its sensation from lateral to midline, from anterior to posterior. The branch of the trigeminal nerve that supply the scalp is from three branches of it: the ophthalmic, the maxillary, and the mandibular division of trigeminal nerve. The first division is ophthalmic division. Is have the supratrochlear and supraorbital nerve branch of ophthalmic division of trigeminal nerve. The supratracheal nerve, a branch of ophthalmic division of trigeminal nerve, went around the superior orbital margin and supplied the scalp. It passed backward, close the median plane, and reached nearly as far as the vertex of the scalp. The vertex means the top of the scalp. So this nerve reached to the top of the skull and is give the sensory innervation of this part of the skull. The second nerve branch is the supraorbital nerve, a branch of ophthalmic division of trigeminal nerve. Winds around the supraorbital margin as ascend over the forehead. It supplies the scalp as far back as the vertex. حقيقة, supraorbital nerve emerge from inside of the orbital cavity to the outside over the forehead by the notch, called a supraorbital notch. This is either notch or as a foramen. When complete ring formation is formed as a foramen, but most commonly is have within notch in the upper margin of the orbit at middle third. The other division of the trigeminal nerve, maxillary division of trigeminal nerve. This division gives a zygomaticotemporal nerve, a branch of maxillary division of trigeminal nerve. Supply the scalp over the temple at the lateral side anterior to the auricle from the that is lateral side of the eye to the anteriorly of the ear. The third division is the mandibular division of trigeminal nerve. We have auriculotemporal nerve. This nerve branch of mandibular division of trigeminal nerve ascend over the side of the head from in front of the auricle. Its terminal branch supplies the skin over the temporal region. It is posterior to the zygomaticotemporal nerve and anterior to the auricle. This supplies the skin inside of the over the parotid gland. We have other nerve front from the trigeminal nerve. It is from the cervical plexus. This is lesser occipital nerve and greater occipital nerve. The lesser occipital nerve branch of cervical plexus, C2, supplies the scalp over the lateral part of occipital region and the skin over the medial surface of auricle. It is posterior to the auricle. That is branch of the cervical 2 nervous plexus. The greater occipital nerve, a branch of posterior ramus of the second cervical nerve, ascend over the back of the scalp and supply the skin as far as the vertex of the scalp. Is go this greater occipital nerve anteriorly to reach within the supraorbital and supratracheal nerve that at the top of the scalp. The blood supply, the arterial blood supply of the scalp has a rich supply of blood nourish the hair follicle. The arteries of the scalp are derived from external carotid artery by occipital posterior, occipital artery, posterior auricular artery, superficial temporal branch, and from the internal carotid artery by supraorbital and supratracheal branch of this artery. All these arteries anastomose very freely and with other the arterial wall are attached to the dense connective tissue of the second layer of the scalp and tend to be held open and blood profuse when cut. The scalping does not cause necrosis of bone of the vault, most of whose blood come from middle meningeal part. The arteries lie in the superficial fascia, moving laterally from the midline anteriorly, like the nerve is arterial blood supply as a nervous supply of the scalp. The two branches of the internal carotid artery is the supratrochlear supraorbital artery. Branch of ophthalmic artery is a branch of the intracarotid artery, internal carotid artery. Is ascend over the forehead in company with the supratrochlear and supraorbital nerve. This is two artery within two nerve. The superficial temporal artery. This is the smaller terminal branch of external carotid artery. حقيقة external carotid artery التيرمينال branch معناتها هي superficial temporal artery and maxillary artery. The superficial temporal artery ascend in front of auricle in company with the auricular temporal nerve. A divided anterior and posterior branch which supply the skin over frontal and temporal region. We have the two artery that is the branches of the external carotid artery from posterior side. It is posterior auricular artery and occipital artery. The posterior auricular artery, a branch of external carotid artery, ascends beyond the auricle to supply the scalp above and beyond the auricle. The occipital artery, a branch of external carotid artery, ascends from the apex of posterior triangle in company with the greater occipital nerve. It supplies the skin over the back of the scalp and reach as high as the vertex of the scalp, and is anastomoses with the supratrochlear and supraorbital artery. The venous drainage. The venous drainage, as the arterial blood supply, is the same artery, is the same nerve, is the same vein. We have the supratrochlear and supraorbital vein unite at the medial margin of the orbit to form the facial vein. These two veins that drain from upper part of the forehead till the vertex of the scalp is united and forming the facial vein. We have the superficial temporal vein unite the maxillary vein and the substance of parotid gland to form retromandibular vein. These two veins from the side and from beneath the base of the skull, that is the superficial temporal, is in the lateral to the superficial temporal artery, and go downward and unite with the maxillary vein to forming retromandibular vein. And the retromandibular vein divided to anterior and posterior division within the angle of the mandible. And we have posterior auricular vein unite with the posterior division of retromandibular vein just below the parotid gland to form external jugular vein. This is the vein that have within posterior auricular artery. Is the vein that drain and unite the posterior division of the retromandibular vein. This is that have below the parotid gland, and then forming the external jugular vein within the neck. The last vein is the occipital vein that drain into suboccipital venous plexus, which lie in beneath of the floor of upper part of posterior triangle. The plexus in turn drain into vertebral vein or to internal jugular vein. This vein that is occupied within the occipital artery is the venous drainage to venous plexus within the base of the posterior triangle is called suboccipital venous plexus. This venous plexus drain either to a vertebral vein or to the internal jugular vein. The veins of the scalp freely anastomose with one another and are connected to the diploic vein of the skull bone and to the intracranial venous sinuses by valveless emissary vein. الفين الذي لا يحتوي على any valve هو vein in the skull. that communicate from external cranial vein to the internal cranial venous sinuses. Now we continue about the scalp is the lymph drainage. Within the lymphatic system, there are no lymph nodes within the scalp, only the venous lymphatic drainage. The lymph vessel in the anterior part of the scalp and forehead drain into submandibular lymph node, and drainage from the lateral part of the scalp above the ear into the superficial parotid and periauricular lymph nodes. The lymph vessel in the part of the scalp above and behind the ear drain into mastoid nodes. The vessel in the back of the scalp drain into the occipital nodes. So the superficial lymph nodes that are present within the face and within the posterior part of the scalp that drain all the lymphatic vessel of the anterior and middle and posterior and lateral side of the scalp. Thank you for your listening this lecture.